Today, we are going to demystify a topic that is a daily reality for millions of people. Hyperglycemia, high blood sugar. We're going to cover why it happens, how to recognize the signs, and most importantly, what to do when your numbers are high. Most of us were never really taught when to worry and when to act, so let's fix that. So picture this. You test your blood sugar and the meter flashes a number like 280. Or hey, maybe it's 350. Your heart probably starts racing a little bit, right? Is this an emergency? Do you need to run to the hospital? This kind of confusion is so common. But really understanding what these numbers actually mean, well, that's the first step to taking back control. Okay, let's start with the basics. The official term is hyperglycemia, and it's actually a pretty straightforward medical term. Hyper just means too much, and glycemia refers to glucose in the blood. So put simply, it's when there's way too much sugar just floating around because your body either doesn't have enough insulin or it isn't using the insulin it has the right way. So what's the magic number we're looking for? Well, the American Diabetes Association sets the general threshold right here at 180 milligrams per deciliter. Now, this isn't just some random number. It's the point where if it stays that high, sugar can actually start to cause damage to your body over time. But listen, context is everything. A 200 after a big pizza dinner is a totally different story than a 200 reading every single morning when you wake up. This 180 mark is really our first signal that we just need to start paying closer attention. Knowing the number is one thing, but if you really want to manage it, you've got to understand the why and the how. Like, why does it happen in the first place, and how does it actually feel inside your body? Let's break all of that down. So your body actually has its own alarm system. When there's too much sugar in your blood, your kidneys go into overdrive trying to flush it out. And that's exactly why you'll feel super thirsty and have to run to the bathroom more often. At the same time, your cells are literally being starved for energy because the sugar can't get in. And that leads to that deep fatigue. But here's the really dangerous part. A lot of people feel absolutely nothing until their numbers are crazy high. You can't wait for symptoms. You have to test. So what's really behind these spikes? Yeah, diet is the usual suspect, but it's often not the only one. When you're sick or stressed, your body pumps out hormones like cortisol that actually raise your blood sugar to help you fight whatever's going on. Then there's the dawn phenomenon, where hormones in the morning can cause a spike. A missed medication dose, maybe some spoiled insulin, certain medications like steroids, or even just a less active day can totally throw your levels off. It's this whole complex mix of factors, and figuring out your personal triggers is absolutely key. All right, let's shift gears and talk about something a bit more serious. We know what can cause a high, but when does that high cross the line from something you just need to correct into a real danger zone? This is information that every single person with diabetes absolutely needs to know. Think of this chart as your guide to action. It's kind of like a traffic light. A reading up to 250, that's like a yellow light. Time to pay attention, maybe make a correction. Between 250 and 400, that's an orange light. You need to take clear action right now. But anything consistently over 400 and especially over 600, that is a red light. This is a potential medical emergency, and you need to get help. And here's exactly why that emergency label is so important. When severe high blood sugar is just left untreated, it can lead to two very dangerous, and I mean life-threatening complications. Diabetic ketoacidosis, or DKA, and hyperosmolar hyperglycemic state, which is known as HHS. Now, this comparison is so crucial. With DKA, the body is starved for energy, so it starts burning fat for fuel. This makes these acids called ketones, which basically make your blood toxic. It's a full-blown medical emergency. Now, with HHS, there's just enough insulin to stop that fat-burning process, so you don't really get ketones. But the blood sugar skyrockets to extreme levels, causing severe, life-threatening dehydration. The lack of those obvious ketone symptoms can make HHS harder to spot, which is part of the reason its mortality rate is so tragically high. Okay, we've talked about the danger, so let's get to the solution. You see a high number on your meter. Panicking is not a plan. So let's build a clear, immediate action plan together right now. Okay, here are the immediate steps. First, confirm that reading. Wash your hands, retest. Make sure it's accurate. Second, if your reading is high, let's say over 250 or 300, check for ketones if you have type 1. Third, hydrate with water. This helps your kidneys flush out all that excess sugar and avoid any more carbs. Fourth, if you have a correction plan from your doctor, use it, but only as prescribed. And fifth, maybe consider some light activity. But listen, there's a big caution here. Only if your ketones are negative and your blood sugar is below 300. Otherwise, exercise can actually make it worse. Finally, recheck your numbers in an hour or two and see if your plan is working. Following that action plan is absolutely vital. But let's be honest, Living in a constant cycle of reacting to highs is exhausting. The real power comes when you shift your mindset from reactive treatment to proactive prevention. Let's see what that looks like. Just look at the difference here. The reactive approach on the left, it feels like you're always putting out fires. It's stressful, it's unpredictable. But the proactive approach on the right, that's about understanding your unique triggers to stop the fire from ever even starting. It's the difference between feeling controlled by your diabetes and feeling in control of your diabetes. You know, proactive prevention isn't about being perfect. It's just about being consistent. It's taking your medication on time, every time. It's knowing how different foods affect you. It's regular monitoring to see patterns, not just single readings. It's having a sick day plan ready before you get sick. And yeah, it's managing stress. These aren't just chores, they are your armor. And as you build these habits, just remember, you are not doing this alone. Here in India, 101 million people are on this exact same journey. This isn't just a personal battle, it's a shared experience, and it's a solvable one. So, after all this information, we really land at the most important question of all. The crucial point is this. Do you truly know your personal patterns? What specific foods cause you to spike? Does stress consistently raise your numbers on a Tuesday afternoon? Does a bad night's sleep guarantee a high morning reading? Answering that question is where technology can be a really powerful ally. Tools like My Health Gheware are designed to do exactly this. They use AI to analyze your glucose data and find those hidden connections, the specific foods, the times of day, and the habits that are totally unique to your body and your life. And really, this is the core mission, as our founder, Health Gheware, says. It's not about data just for the sake of data. It's about using technology to finally give you control. Understanding your patterns is the absolute key to moving from reactive to proactive. You can learn more about how to do that at health.gheware.com. And please remember, this explainer is for educational purposes. It is not a substitute for medical advice. Always, always consult with your personal healthcare provider for any diagnosis or treatment decisions. Thank you so much for tuning in.